Good afternoon and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. Today, we will be talking about the Centers for Medicare and Medicaid Services 5-star quality rating system for nursing homes. Everyone will be on mute, but if you have any questions, please enter them into the chat and we will address them at the end of this webinar. We encourage you to join us every Wednesday at 2 p.m. for more webinars in this series. Next week, we will be talking about emergency preparedness for long-term care facilities. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest today, Pam Metter. Pam is the Director of Regulatory Services with the West Virginia Healthcare Association. Welcome, Pam, and thank you for joining us today to talk about our 5-star rating system.
Thank you, Kathy, for having me, and thanks to Quality Insights for hosting this fantastic series of presentations. So we're going to go ahead and jump right on into the presentation because we got a lot to cover, and hopefully we'll have time for a live example, but we'll just go ahead and start. Kathy, when you're ready.
Yes, that's right. So instead of a normal Q&A form, we're going to be having Pam do a presentation, and I will be sharing my screen here in a moment. Yep. And as we go along, anyone, if you have questions, just drop them on into the chat. All right, so I'm sharing my screen. Let me make this. Let's see, there we go.
Okay, fantastic. Today's presentation is Regulation Navigation Series that we're going to be discussing the survey process, which is the engine that drives the 5-star rating for nursing homes. And the reason we just talked about doing this was because we had several questions about folks having their infection control surveys that they had during the COVID pandemic, when the state surveyors would come in and they would perform these infection control surveys, and folks just really wasn't aware of how that fit into their 5-star survey portion of the 5-star rating. So next slide, Kathy.
Did it toggle over? Try again. There we go.
There you go. Just as a quick reminder, I'm sure most of you guys are familiar with the 5-star rating system, but I just wanted to provide you with the link that takes you to the Nursing Home Compare Technical Users Guide. They still call it Nursing Home Compare Technical Users Guide. They haven't changed the name yet, but it is for April 22 is the most recent update. Next slide. Now we're going to be looking at Care Compare. This used to be Nursing Home Compare, but it is now Care Compare. And again, the link that you can find right below Care Compare is where you will be going when you look for your facility or other facilities within your company. Anybody that you're wanting to look at within the nation, you can go to Care Compare and find this data about, it's all public data. It is readily available for anyone. So when you click that link, you're going to come up with Find and Compare Nursing Homes, Hospitals, and Other Providers. You'll go down to Nursing Homes and you'll notice that I have already placed West Virginia in my location. You can put in any type of city or state. You can put in the nursing home facility name, anything, and then you're going to click search. Next slide. When your search comes up, you'll see my West Virginia facilities have come up, and the first one is Anstead Center, but there's several under that. It's just I couldn't fit them all on the screen because there are 123 facilities within the state, but gives you an idea of what you're looking for. Now, when I was preparing this, what I did was I chose a facility that had a couple of special things that I wanted to show you, but I took out their name to protect the innocent and the guilty. And it is not Anstead Center because you can see they're a 4-star above average overall rating. We chose another facility that had a couple of special things that I wanted to show you. So if you'll go to the next slide. This facility, which is named Center at the top, as you can see, has an overall rating of 3 stars. Now, I wanted to explain to you a little bit about that before we move forward into the actual health inspection portion of it. Their overall rating being 3 stars, but their health inspection is 4 stars. And if you'll look over, their staffing is 3 stars and their quality measures is 1 star. So that 4-star health inspection, which is where you start with your star ratings, lost a star because of the 1-star quality measures. So this facility in particular had a fantastic survey history, it looks like, but looks like they need to focus a little bit on quality measures, which we're not going to be discussing today, but just in general, when they pull this up, they can see where they need to be focusing their energies on. So if they just brought that up 1 more star, the quality measures up 1 more star, they would maintain a 4-star staffing. It would be a 4-star overall. I'm sorry, not staffing, overall rating. So they lost a star by just being 1 quality measures. Now, if they brought their staffing up 1 more star as well, 1 more quality measure, 1 more staffing, they could be a 5-star facility. So it's not unobtainable. It's just something that you need to focus on and realize. Now, you'll notice the arrow that I have there under view inspection results. So we're going to click that arrow, and next slide. This is what comes up. Now you'll see I've got it in two separate columns here, but that's because, again, it would be too small for you to see. This is what would come up when you click that health inspection. It gives you a synopsis of the health inspection data for this facility. It tells you their most recent health inspection, and it tells you if there was any complaint inspections for that inspection, and it also tells you their infection control inspections that falls under the most recent inspection. Now, I don't really pay much attention to this page. What I do is, you see the purple arrow, we click that link there and it takes us to a pop-up, which next slide. Here is the one that I look at when I'm looking for 5-star information. You will notice that, I've got to get rid of, let me see. There it is. If you'll notice that there are 3 inspection dates listed at the top. Those are their 3 most recent surveys, and those are the ones that are counted towards their 5-star. They had one on 6/30/21. They had one on 11/14/19, and they had another on 12/13/18. So those are the 3 that are being counted. Now below that, it tells you the complaint reporting period, which means if they had a complaint survey during April 1st of 21 through March 31st of 22, it will fall under the June 30th 21 survey. Now it says complaint reporting, but that also includes the infection prevention surveys that they've done. So any infection survey that they've done 4/1 of 21 through 3/31 of 22 falls in this category as well. Same thing for the next one, 11/14/19. You'll notice that the dates there are 4/1/20 to 3/31/21. Any complaint or infection control surveys fall under there as well. And then the last survey, which is 12/13/18. And then the complaint surveys are listed there below it as well. So this is one that we're going to be coming back to, because this is how we determine the 5-star. The point values that we're going to be figuring up in a bit that are determined by where these surveys fall, and I'll explain that a little bit more in just a bit. So go to the next slide. So on down, when you are looking at this, you're going to scroll on down and you will see detailed results for the inspection on 6/30/21. This is the one that is most recent. And now if they've had a more recent one, like this facility had a survey just recently, and it was a really good survey. So it's not on here yet because it hasn't refreshed, hasn't updated. When it does refresh and update, of course, this newest survey, the one that they just had in May, will take off the very last survey. So it'll be the first one. The 6/30/21 will be the second one, and then the one they had the one they had in, I believe it was December of 19, will be the third one. So, but as for right now, this is the most recent one, 6/30/21. Now on this screen, you can click view full report, which we're not going to do on this, but all that does it gives you the exact survey report with all of it de-identified, but everything that the facility has in their survey book that's at the front of the office so that anybody can come in off the streets and look at your surveys, that's exactly what that is. So if you want to see what the specifics are for this survey, you click that and you'll be able to see their full survey report. It also tells you that there was no complaints surveys during that time, but they did have an infection. They did have an infection control. They did have an infection control survey on 10/13 of 21, which you could view that report as well. And then it tells you during this survey, they had 4 tags, and then the average number of deficiencies in West Virginia, and then nationally. So next slide, if you go on down. When you go on down, you will see a kind of a synopsis of the 4 deficiencies that were associated with this June webinar, or this June survey. And the 1, 2, 3, and 4 is something I put in there. I just wanted to show you what it looks like, the 4 surveys. Those things are the tags that this facility received. The first tag is, and you'll notice at the top there, it says freedom from abuse, neglect, and exploitation. There were no tags associated with this during the survey. So it's an easy way to tell if a facility is potential to get the abuse icon. Next one is quality of life and care deficiencies. The first tag is there, and it says provide appropriate treatments and care according to orders, residents' preference, and goals. And I apologize, my vision is very, very poor today. I've got blown eyeballs because I went to the eye doctor yesterday. But anyway, we'll get through this, I promise. So you'll see the first tag is that, and it occurred on 6/30/21. So that was during their annual survey. What we're going to pay attention to is the level of harm, least to most, and then the residents that are affected. You'll notice that they have the 2 block there, and then it says a few. So the 2 is minimal harm, excuse me, or potential for actual harm. So, and it's a 2 and a few, which you guys will probably reckon with a D level deficiency. Same thing for the number 2, level 2, few were impacted. And it's also for 6/30. Now, if you go to the right-hand column, you'll notice the date on this 3rd deficiency is different. 10/31/19, I believe that's what it says. Or no, 21, I'm sorry, 10/31/21. That was an infection control deficiency that they received during the infection control, not an infection control deficiency. It was a deficiency they received during the infection control survey that they had. It wasn't during the annual survey, but it falls just as if the annual survey deficiencies fall. But it also was a 2, and it was under few, and it was residents' rights deficiency. So it was not infection control, which is better, because the more infection control surveys you get and the more infection control tags you get, you might potentially get some CMPs for that. And then number 4, the 4th tag is also a 2 and a few, which is another level D deficiency. So we're going to take all that information and we're going to use it in order to determine how they get the points for this first survey. Next slide. Okay, here it is a little closer, which I probably could have used earlier when I was trying to read everything, but we'll go to the next slide since I've already went over all of that. Now, this is something that I did. If you will pull up the technical user's guide for 5-star, you'll see this table, and it's something that when you pull it out, I don't know why they don't choose to use the same verbiage as they do in the 5-star or the Care Compare website, but they didn't. They use isolated, pattern, and widespread, but you'll see that it's the same as few, some, many. And then the levels 1, 2, 3, 4, you'll see the level 2 that we've talked about and few equal 4 points. So Kathy, if you could go back one slide, I want to kind of show what I mean. So you'll see level 2 of few, level 2 of few. Go to the next slide again. For those 2 deficiencies, each one of those are 4 points. So that would be 8 points for those 2 deficiencies. And if you'll remember, the other 2 deficiencies for the 630 survey were also few and level 2 few. So those were another 2 for 8 points. So you've got 8 points and 8 points. So we got 16 points for the first survey. Next slide. When you scroll on down, then you're going to see the next survey on the list. Same exact thing. You've got the second survey on 11/14/19. You can view the full report. But on this one, again, no complaint surveys, but they did have 3 infection control surveys that you will find the full report. And this is kind of why it fits in COVID, because you are able to go here and find the facilities infection control surveys that they've had. You can find the full reports. You can see how their infection prevention tactics are being monitored and what the results are of the surveys are. So of your facility, you can see what the public sees about your facility. And you can also see on this survey, they only had 4 deficiencies as well, which is fantastic. It's a great and you'll notice that the average in West Virginia was 11.4. West Virginia has historically had a tough survey process. So you can see the average is 11.4. So 4 deficiencies is fantabulous. And then you roll on down, and you will then again see the scope and the level of harm, and then the residents that are affected on each one of the deficiencies. So you do the very same thing for 11/14/19 survey process. Next slide. So, and there it is a little closer, but you'll notice on this one, on the one for 11/14, even though they had 4 deficiencies and the first survey was a 16-pointer, this one, the first deficiency is a level 2 with few residents affected, but the next deficiency is a level 2, but some residents are affected. So go to the next slide. I think I put yes, I did. Look at there. Look, I do know what I'm doing sometimes. So level 2, but some residents. So you'll know how many points is that? How many points do we need to add for that one deficiency? And it shows here, it'll be that for that one deficiency is an 8 points. So it's going to be a higher number, even though they only had 4 deficiencies, it's still going to be a higher number, a point value than what their first survey process had. So, and I'm going to pull it all together at the end, so you'll be able to see it all at once. Next slide. Okay, in order to determine the total points, what we have to do is you have to add each of the 3 survey dates separately. You add them just like we just did. The initial survey or the most recent survey, the next survey, and the next survey they're all added to separately. Then you're going to divide the most recent survey points by 1/2. So we said, and I'll do it later, but I'm just going to go ahead and tell you. So the first one was 16 points. So we're going to be utilizing 8 points because it has a heavier weight than the most recent survey has a heavier weight than the other 2. And then we're going to divide the second survey points by 1/3, which was, what did we say it was? It was, I think it's on the next slide. My math sucks. So I'll pull it all together in just a minute. And then you're going to add up the third survey points by all together, and you're going to divide them by 1/6. Add them together, and then refer to your state's cut point table here. And I put the link there as well. Go to the next slide for me, please. And here's an example of the cut points for health inspections. They update this routinely, quarterly, so that you would be able to see what where the points lie. So I've talked with one of my other facilities recently, And I told them that they're right on the lower level of a 3-star. So I told them, depending on what the cut points are when it's updated, whether or not they're going to be a 4-star or if they're going to continue to be a 3-star, because it's all percentages. It's all based on percentages. And I've got the link for this is is going to be included in this as well. So go to the next slide. So here are we already go to the next slide. The next one. Okay. Again, you'll notice that we had the summary, but notice the very last inspection date, the 12/13/18. Notice how many deficiencies they've gotten on that one. They've got 2, 3, 4, 5, 6, 7, 8, 9, at least 10 deficiencies on this last one. So if they just had a survey in May and they did not get very many deficiencies and they were all low level, so if they got 4 deficiencies, say, like they've routinely gotten the last 2 surveys, and when that one is put on here and this 12/13/18 drops off, they are going to have a much better star for their health inspections. They are very well on their way to a 5-star if they work on those quality measures. Nothing can stop them from a 5-star. All right, next slide. Okay, so this is again I wanted to show you what the point looked like whenever you determined the point value. Go to the next slide. Next slide. Looks like I put some repeaters in there. Next slide. Okay, here it is. This is what I was looking for. All right, so in 6/30/21, the most recent survey was 16 points, which we determined by adding up all the different fews and minis and twos and that kind of thing. They got 8 points for that, and we divided it by 2. The 16 by 2, they got 8 points. So the second survey, which was 11/14/19, they come up with 20 points. Again, remember, they only had 4 deficiencies, but they had a higher level of residents affected, so it increased their points a little bit. So 20 divided by 3 is 6,666. You can't make that stuff up, or 7 points. So 7 points is what we're looking at. And then their third survey, they had 12 deficiencies. Which was on 12/18. They had 60 points, and we divided by 6, and that equals 10 points. So their total is 25 points for their star status. So go to the next slide. And you'll see in West Virginia, if you go all the way over here, if their points were 45.333 to less than 21.333, then they are considered a 4-star deficient survey health inspection points table. So there were 25 points. 25 is larger than 21, so they are 3-star. They are not far from a 5-star. I'm sorry, they're 4-star. They're not far from a 5-star on survey. So potentially, if we look at their deficiencies and we add up their using the table, we add up their newest survey and drop off the one that was in December, we're going to be able to pretty much accurately determine what their survey pointage is going to be, and then again what their health inspection engine is going to be to start their survey process. All right, go to the next slide. Again, they were 4-star, which is what we just saw on the cut points table. And next slide. I believe we're getting to where I can go to the, yes, I'm gonna share my screen if I can. I'll share my screen, and I am going to go live if I can find the correct. Let me try this. Yes. Now, what I'm going to do is I'm going to go I'm going to go to a facility in Wyoming. Let me see. Can you see my screen, Kathy, or is it still?
I can see it.
Okay, so you can see Medicare.gov.
Yes, we can.
Fantastic. Okay. If you'll notice here, I am in Wyoming. I just went to a Wyoming because none of us are from Wyoming, or maybe if we are, we still might not know this facility. But again, it's all public data. So we're not doing anything we shouldn't. But I wanted to go to Granite Rehab and Wellness because I wanted to kind of just give you an idea of how impactful this can be. They are a 1-star overall. And that is because they've got the 1-star health inspection. 2-star staffing does nothing for them. 3-star quality measures doesn't do anything. The only thing that would raise their stars for quality measures is if it was a 5-star quality measure, and that would raise them 1 more star. But the engine that drives it is the health inspection, and it's a 1-star. So we're gonna view their inspection results, and we're gonna see that, and I'm gonna go all the way to the bottom like we discussed. Maybe they had, look how many infection control surveys they had. I wonder why. You know, that's a lot. That's a lot for them to be looking through. So they need to be very familiar with what's what inside of these infection controls. So I'm going to click the bottom like we talked about, and it shows their summary. This summary is going to show you their most recent inspection date, which is 4/8/21. Their inspection, the second one, which is 4/11 of 19, and then 10/12 of 18. And I'm going to scroll down, and we're going to look at the first one, which is 4/8 of 21. There are all those infection control surveys. So that is where you're going to find that, but you're going to find the deficiencies that's associated with it all intermingled. And you'll see they've got 2 of few, which was again a D, and that was 4 points. Too few, but let's scroll on down again. To some, which was an E level, and that's 8 points when we add it all up. And let's see here. There is, and then here is their results for 4/11 of 19. And again, tons of infection control surveys. And too few, to some, again, all 4s and 8s right there. However, right here under infection control, they did get a few, but many. And when we pull up the document, the other document with the how many points that is, I'll have to pull that up to see exactly, but it will increase. I think it's 16, maybe. I'd have to look. But again, that impacts their 5-star huge. And then I think the reason I chose this one was because I'm pretty sure somewhere they have a 4, there's a 3 actual harm, which is higher points as well. So you have to let folks and be aware that if the higher the scope and severity, the higher points that you have. And I know they had an immediate jeopardy somewhere, which could be upwards of 100 points. I'm trying to see if I can find it. Sorry if I'm making you dizzy. There it is. So you can see here, immediate jeopardy. If we go back to the point cut table, an immediate jeopardy could be up to 100, 175 points. So luckily on this one, this is their 3rd most recent survey. So it will be dropping off once they get their new survey. So therefore, I would be praying if I was this facility for a new survey and for it to be, pretty decent. It would have to be pretty bad for them to not increase in points. So I hope that gives you just kind of an overview on how to utilize the survey engine, how to start looking at your survey process as the beginning part of your 5-star. I'm going to stop share maybe once I can get my mouse over here. Maybe. Oh, there it is. Stop share. Now, let me turn my camera back on. There we go. Now, any questions, concerns, comments, snide remarks, anything at all?
So far, one of the questions in the chat is that they wanted for me to screen share your slideshow again because they were taking notes about the points. So I'm going to share that again.
Well, and we can also send this out. It's not something that's proprietary. You can share that with anybody who needs it.
That's right. That might be one of the better things you can do. For those who are interested, how about you shoot us your, or how about I'll have you email me.
Okay.
I'll drop my email in the chat real quick, and then you can email me and I will send you the slideshow. We'll probably put it some other places where you can find it, but for those of you who are here on this webinar, I bet that would be the easiest thing to do. So let me pull up the chat real quick.
And if you need any help looking at your survey process and looking at your the engine that drives what your facility survey is doing, we can absolutely help you doing that as well. Folks at Quality Insights are fantastic with this stuff. Here at the Healthcare Association, we can help you with this stuff. We're here so you guys can succeed. So anything we can do to help, that's what we're here for.
That's right. And then I also have dropped a couple links from your slideshow into our chat right here. So if anyone wants to click on those, that might actually have some of the information that was on that slide.
Yep.
And let's see. All right. So I did get an email. And actually, let me copy that real quick just to make sure that we don't lose it. And wait another moment, see if anybody else has any questions, emails to drop in. You can click on my email and hang on to that and email me if you have anything that you want me to send you after this. I believe we're getting close to being able to wrap up though.
All right. Well, thank you guys so much for your attention, and I apologize for the technical delays. I'm not familiar with this. My computer went, so I had to come and use one that's not familiar with me. So we make it happen though, don't we, Kathy? We make it happen.
Somehow it still comes together.
Yes, it does.
It's amazing.
All right, guys. Thank you all so much.
All right. Before you sign off though, I want to do our little outro script with just a little more information.
Okay.
All right. Get that pulled up here. Okay. So yeah, I would like to remind everyone again, actually, let me copy one more link to post in the chat. And then I will wrap up. All right. Okay. So I would like to again remind everyone that we will have another webinar next week. It will be on emergency preparedness for long-term care facilities. That will be next Wednesday at 2 p.m. We also host office hours live chats twice a week. So if you are looking for one-on-one advice for your facility, you can pop in during our office hours and shoot us a message, and someone will be there to answer those questions. And those are every Tuesday at 8 a.m. and every Thursday at 2 p.m. And you can find the links to those live chats and our webinars in our newsletter that we send out each Friday that is called the Last Minute Lowdown. And if you don't think you're on the list to get that newsletter, I just dropped the link in the chat that will tell you how to get on that list. Or if you can also just email me, which I also dropped in the chat a moment ago. And you can check out our other interviews by visiting qualityinsights.org/QIN/multimedia. That's qualityinsights.org/QIN/multimedia. And I would like to thank you all for joining us today. And Pam, thank you so much for joining us today.
Thank you for having me. Y'all take care.
Thank you.
Bye-bye.